Hello, Dr. Chu. My name is Sun. I am a nurse calling from the orthopedic floor. How are you doing? Good. So I have a situation. I have a patient in room 4, Mr. Smith. He started complaining of sudden onset of chest pain and also shortness of breath. He is also desaturating down to 88% on 6 liters nasal cannula. And with all these sudden changes, I am concerned and I decided to call you. So background-wise, Mr. Smith is a 55-year-old male patient. He underwent right total hip replacement surgeries 3 days ago. So it's his post-op day 3, and he was recovering just well. So we were actually giving him discharge instruction, and that's when he started complaining of this sudden onset of chest pain, and also he is having some shortness of breath as well. So assessment-wise, his blood pressure is 120 over 80. He is breathing kind of rapidly, 35 breaths per minute. As I mentioned, he is desaturating on 6 liters nasal cannula, currently 88%, but prior to that, he was setting down to 82% on room air. He is a febrile 36.4 Celsius. He is describing this chest pain as very sharp, and he's rating 8 out of 10. In terms of his shortness of breath, we auscultated his lungs, and it sounds like his right side is distinguishably more diminished than left side. So considering everything that's happening, I did give him oxycodone PRN PO 10 milligrams just like 5 minutes ago or so. But it is PO, and he is still complaining of chest pain, 8 out of 10. So my recommendation is considering the sudden onset of chest pain, shortness of breath, and the fact that he had orthopedic surgery. I'm a little concerned about possible PE. So would you like to put an order for chest x-ray? Cool. And also, how do you feel about putting EKG, because I want to make sure that this is not anything related to cardiac episode. Okay, so are you going to put those 2 orders? Thank you so much. I appreciate it, Dr. Chu. Goodbye. Alright, so that was my demonstration of SBAR, or also known as iSBAR, in a situation where you have to communicate with your provider, which will happen to you guys one day. There's another video of SBAR on Canvas, and I made that to demonstrate SBAR used in RN to RN report situation. So that might include a shift change report, for example. So if you're a day shift nurse, then you're reporting out to night shift nurse and vice versa. Or if you're transferring out your patient from your unit to another unit, you do also have to communicate with the nurse that's receiving your patient. So that was a video I made in the past, and then this time it's an iSBAR video specifically for RN to provider, which might include MD, nurse practitioner, or PA. Okay, and so let's break it down. So we call it iSBAR because obviously any type of conversation should start with introduction. So I mentioned my name, the fact that I'm a nurse, and do not forget to mention where you're calling from, because a lot of the times providers do oversee like more than one unit. So especially like if you're working at a larger hospital, there are like multiple units. So make sure that you're mentioning where you're calling from. Otherwise, if you say like I'm calling about this patient in room 4, they would think like room 4 of what unit. So yeah, let's not forget to mention your unit. Now moving on to situation. This is where you mention why you're calling, and you shouldn't include too much information in this situation part, because you want to make it clear, concise and succinct. That way the provider understands why exactly you decided to pick up your phone and called him or her. So in my case, I made it really clear that there is this patient who's having chest pains, shortness of breath, and desaturation situation. And those are my 3 main concerns about this patient, and that's why I called. And then moving on to background, that's when you give the provider a little bigger picture of what was happening prior to this incident. So I mentioned his age and the fact that he had orthopedic surgery. It's been 3 days and he was doing just fine. But then all of a sudden, he had this change of symptoms. So that will give the provider a bigger picture of what could be possible cause of this chest pain and shortness of breath. With that said, you don't have to include too much information such as like social history or like any other information that is not really pertinent to the change of situation or change of symptom in patient. So again, even though you're giving the provider bigger picture, try to kind of decide what information you include in this background section, which takes a lot of time and practice. Now, okay, so let's move on to the assessment part. This is where you mention all the pertinent data about the patient's changing condition, including subjective and objective data. Your favorite topic, right? So subjective in terms of subjective, I include the fact that the patient is describing the chest pain as sharp. So provider might differentiate one possible cause to another depending on this description of the pain. So that is definitely pertinent information to his changing condition, his meaning the patient's. In terms of objective data, you can always include, but you should always include vital signs because that's definitely pertinent data. And also auscultation. So if the patient is having shortness of breath, you definitely would want to listen to the lungs. And the fact that the right side was diminished is a very important piece of information that the provider would like to know. So I included that as well. In assessment part, I also included the information about the fact that I gave him pain medication because obviously the patient is experiencing pain, and if we don't include that information, then the provider would probably say like, did you give him pain medication? So to omit that situation, I mentioned that I gave him oxycodone PO 10 milligrams about 5 minutes ago. So the time, route, and everything, because if I said I gave him IV Dilaudid, which is another opioid pain medication, it would work immediately. So that's why I mentioned PO, because if I gave him pills 5 minutes ago, whether it's a strong pain medication or not, it wouldn't work that quickly. So the provider might benefit from knowing what route I gave. Oxycodone is only available for PO, but anyways, and then I move on to recommendations. So as a nurse, this is definitely something that takes a lot of time to practice and kind of gain knowledge and confidence of. But as a nurse, you kind of want to have a plan about the situation. So definitely at the end of the day, the providers will determine the course of treatment. It is not our scope of practice to diagnose or come up with a plan, but also like kind of just like anticipate what would be needed for this patient. So that's why in the recommendation part, I recommended something that I think should be done. And provider might say like, no, that's not necessary. And if that's the case, then you say, okay, you just document that the provider says so. But again, recommendation part is something that takes really a lot of practice. But as a nurse, we have ability to recommend something. So that's something that I wanted to show you guys. So hopefully this SBAR demonstration helped you guys kind of understand the flow of SBAR or iSBAR in terms of RN to provider communication. Okay, well, let me know if you guys have any further question. My email address is available on Canvas, or you can just shoot me a message through Canvas as well. All right, goodbye.